I'll talk through this and then I'll demonstrate. And then you can do a sternum rub or shake the individual. If still that's not the case, there's no response, you can look, listen, and feel for breathing. And if the breathing is slow, irregular, or absent, you can administer Narcan. And so the Narcan, it's held like this, thumb on the plunger, index and middle fingers between the nozzle, inserted into the nostril, and then the plunger is depressed. And you've administered a life-saving dose of Narcan. Within the first few minutes, the individual should start breathing more normally. If that's not the case, you can administer another dose of Narcan on the other nostril. So just a caveat here, we're seeing unfortunately more and more opioid overdose victims requiring multiple doses of Narcan. This is because there's more and more heroin being used, stronger, more potent opioids, so that's something to keep in the back of your mind. When the individual resumes breathing, you would want to roll him or her on their side. It's called the rescue position. And then finally, I have to emphasize, you may cause an opioid withdrawal syndrome. It's uncomfortable, but it's not life-threatening, and that should never preclude you from administering Narcan. And then finally, this individual should go to the emergency room for two reasons. One is they may still have long-acting opioids in their system that may stick around for several hours. And two, the emergency room, we're seeing more and more emergency rooms intervening, treating addiction, starting buprenorphine, and getting these folks on the road to recovery they deserve. So with that, I will show you how to do this. Sir, are you okay? Sternum rub. No response. Look, listen, and feel for breathing. I don't really see chest rise. At this point, administer Narcan into the nostril, depress, and then within a few moments, up to 2-3 minutes, it looks like he's breathing. That's great. I'll roll him on his side. And then wait until emergency medical services arrives to get him to the hospital so he gets the care he deserves. Thank you, Raymond.
Yay.